This is Get Connected with Nina Del Rio on 106.7 Light FM.
Good morning, and thanks for joining us on Get Connected. You may have heard the names of current street drugs or be familiar with club drug names like GHB or ecstasy or roofies. But what's their effect? What do they look like? What are the dangers, and what should you tell your children about them? Dr. Susan Brill is chief of the Adolescent Medicine Department at the Children's Hospital at St. Peter's University Hospital, joining us with answers for parents about street drugs, prescription drugs, and their dangers. The website is stpetershcs.com, and Dr. Brill, thanks for joining us today.
Oh, thanks so much for having me.
So we're just going to jump right in. What are currently the most popular drugs in use among teens, the most common street drugs or club drugs?
Okay, so when you're talking about street drugs, I mean, certainly cigarettes and alcohol are still the most common drugs. The next in line is what you might call a street drug would be marijuana. And there's actually, been some interesting news about marijuana and how frequent it is, but I think a big change with marijuana has been that teens are perceiving it as less harmful than they had done it before. The amount of people using marijuana has been about the same, but it's considered less harmful, and actually more children and teens are consuming it as an edible. Other, what you might call street drugs, are actually prescription drugs, which is the next most popular drug of choice. And these are usually opiates or stimulants that are commonly prescribed and very easy for kids to get their hands on. And this is, I think, often referred to as prescription drugs. Even over-the-counter drugs are sometimes used to excess and therefore abused in kids and teens.
And those are things kids are getting out of medicine cabinets?
Usually. The over-the-counter drugs typically are cold and cough medicines that contain dextromethorphan. It's a small percentage of kids who are using these drugs, but it still is a fair amount of teens that are experimenting with this as a means of getting high.
I want to get a little bit more about that prescription drug issue and sort of the responsibility of parents and physicians in that world. But as far as things like ketamine, GHB, meth, that kind of stuff, which are perhaps the most dangerous or even deadly in that category?
I think talking about the prescription drugs is mostly opiates. Vicodin, Percocet, oxycodone or OxyContin. These have been, very dangerous drugs that have been circulating, and they can be deadly, particularly if they're combined with alcohol, which a lot of times teens are combining medications with alcohol, and this can really lead to severe respiratory depression and, God forbid, even death. So that's an extremely dangerous drug. GHB, Rohypnol, these are things that are around. They're not as commonly used, but they are around, and often these are medications that are misused in order to sedate somebody or really almost put them to sleep, and unfortunately has been used in things like date rapes and sexual assault.
Well, for the purposes of this interview, I really want to focus on kind of those sort of random acronyms of drugs we don't even really know what they are sometimes. Like ketamine is primarily used as a veterinary anesthesia.
Correct. And it creates what we call a dissociative state. I believe the anesthesiologist will use it sometimes, even in